We're broadcasting from the Middle Tennessee Electric Studios. Visit mte.com.
This is a WGNS Action Line. Talk Rutherford County News
since 1947.
The WGNS Action Line. Now your host, Scott Walker.
Now joining us live in studio, Dr. Greg McCabe from McCabe Vision Center. How are you this morning?
Hey, I'm great, up and running, ready for the week. And boy, you know what? It's not going to rain today.
It's not. In fact, several days in a row, I think. But that heat index is like 110 in some areas of Middle Tennessee this week.
Yeah, and boy, aren't you glad you don't live in areas like Phoenix, Denver, and those places? They're literally ablaze. But gosh, isn't that weird in the country? Some people are really suffering drought, fire, everything burning, and then here we get rain every day. It's almost like we're in Hawaii.
Yeah.
And everything's so green and lush. And, the good thing about it here is that it washes a lot of allergens away. So there's not as much allergic conjunctivitis and sinusitis and stuff this reason. Now, don't get me wrong, I'm a goldenrod sufferer. That's my main baddie, and they come on in August and September, so I'm starting to feel some of that. But I appreciate when the rain washes the pollen down our sewer system. But everyone's also out working in the yard because you got to mow the yard now. Before, like last year, if you remember, you'd have to mow the yard because it was brown.
Yeah, that's absolutely
now
right.
You got to work on the yard, which is a good thing.
Yeah.
That's a good thing. So you can get issues that way. And I hope everybody's wearing their eye safety protection, at least a pair of sunglasses out there. And then the other thing I should tell you is that this month, August, is one of the best months to look up.
Okay.
So there's some wonderful things happening in the sky that you can see with your naked eye this month. And if you just Google that, what's happening in the sky that you can see with your naked eye this month, you'll see some neat things. And I'll leave it at that. But let's talk about eyes.
All right.
So if any of your multitude of listeners out there have any questions about their eyes, maybe their families or their neighbors or their spouses, their loved ones, whatever, and it could be anything: glaucoma, macular degeneration, diabetes, glasses, contacts, cataract surgery. We also have a full skincare center at McCabe Vision Center to get rid of your red and brown spots and wrinkles and make you look years younger. We have everything you need for that. So anything's on the board, bring it to us. We'd love to answer your questions.
Yeah, earlier this morning, before the news and all that, I mentioned Dr. Craig McCabe would be on the air, and I also mentioned that he also does things like Botox and skin care like you were talking about. So I encourage people to go ahead and start texting in any questions they may have had. And I think I saw one or two about Botox, but one of the questions was, why do some people suddenly notice more floaters in their vision, and when should they be concerned about it?
Oh, so great question, because it happens to so many people. So it's normal to have a floater or two as, we get past the age of 50, I would say. And they float around in the jelly in the back of our eyes. So if they happen to get right in the center of our eye, where the visual axis and things that we see and the optical pathways are involved, then they'll interfere with that. And if it's a brightly lit background, like a white wall, fluorescent light, bluebird sky, computer screen, all those kind of things, window, then you may see a little gray spot moving around. Heck, you may even swat at a bug that's not there. That's one of those common symptoms. And your friends say, "What are you doing?" "Well, I'm trying to get that bug." Well, there's no bug there, but you're seeing a floater in your vision. So that's normal. The thing that's not normal is to see 20 or 30 bugs, like there's a swarm of them there in your vision. Or if you have a flashing light or two, that can be normal. But if you have 20 or 30, That's definitely not normal. The thing that's ominous that's not normal is if you see a dark curtain, like a veil of blurred or dim vision, move from the lower part of your vision to the center, then that is a real reason for concern, as well as seeing a lightning storm going off in your eye, or 30 bugs, like you're looking through a swarm of bugs, any of those kind of things. You should see your eye care professional within 48 hours.
You know, it's interesting you said that, because one of the questions texted in, it says, what does it mean when someone occasionally sees flashes of light in the corner of their vision?
Yeah, so if you just see one once in a while, it's not many like that. No of the other associated symptoms. You haven't had any head trauma. You haven't been bungee jumping or mud wrestling, any of those kind of things. Then that's normal. And it's where the jelly in our eye, which happens around the age of 50, younger if you're very nearsighted, later if you're very farsighted. But when that happens, the jelly, called the vitreous in the back of the eye, is pulling away from the retina. And as it does, it can mechanically stimulate those underlying rods with which we see with, and you can perceive it as a flash of light. And it's a good idea to make an appointment with your doctor just to get it looked at once. Make sure it's not a little tear or something developing. You know, like we've always said on this program, a stitch in time saves 9, an ounce of prevention's worth a pound of cure. All those good things that our parents taught us are really true. And it's the same way with most things in medicine. If you can treat them early, you can treat them more easily and without less damage to the organ. And in this case, it'd be the retina of the eye. So it's very important that if you have any of those 3 major symptoms, you get seen right away. But if you're just starting to get it, you can make an appointment to see your eye doctor. It's probably been a while. You're probably due anyways. And just get a thorough check over. Now, this has to be one where they don't just take a picture of your eye, but where you get the dilating drops, your pupils get dilated, and the doctor puts that headlamp on the top of their head, looks through it. It looks like he's going mining for diamonds or something. But that one is the one that can look all around the periphery of your eye.
Another question we had here, this is one we haven't had before, and I'm curious about this. What causes, and can you help with, dark circles and bags under my eye? It says that I have noticed bags under my eye as I have gotten older. I am 48 now. Is there anything that can actually help this?
Well, yeah, I mean, of course, it depends what it is and what's causing it. But if it's the normal kind of aging process where our skin starts to develop some discolored spots, maybe some hyperpigmentation from sun damage, those kind of things, then we have excellent treatments for that. Some of the over-counter ones are those skin lightening creams, and they'll do a little bit, but not a lot. If it is significant, then you may need to have some intense pulse light, IPL. We have one of the best machines for this at our office, and it removes the pigment from the skin to lighten it. And so that's something that makes a big difference rather than just bleaching it. This one actually removes it. It's kind of neat. About a week after the treatment, you can see the little spots of pigment like little pieces of pepper coming to the surface of your skin that just flake off and rub off and is gone. And that's a very nice thing to lighten those pigment spots. If that's something you're interested in, give our office a call. We'd love to do an evaluation of that for you. Assuming you haven't, gotten any shiners or anything like that. Sometimes people with thyroid disease can have changes around the skin textures and stuff of their eyes. Certain, let's see, medications like blood thinners. They, of course, I tell people it's a joke. You can look at a coffee table and get a bruise on your knee. And that's just like anything you barely touch, you get a little mark for on your skin. So assuming it's not those things and everything else is normal parameters, then you can just have usually it's a series of 3 of the intense pulse light IPL treatments, and that takes care of that quite well.
Is it true things like a lack of proper sleep each night, do those types of things lead to like bags under your eye, or is that just a myth?
Nope, that's absolutely true. There's so many things. You could do a whole series on getting enough sleep versus not getting enough sleep. But it's actually one of the variables. If you were to go to a longevity doctor or someone that works on you living longer, healthier, more productive, they're going to tell you that sleep's one of the most critical things.
That's so fascinating to me, how sleep really does play a role in your health in such a major way.
Now, you can be in bed with your eyes closed that long.
Yeah.
But if you're not going through the sleep cycles, the initial sleep, deep sleep, REM sleep, all those, you're still not getting enough sleep, even though you're in bed with your eyes closed. Or maybe you snore a lot. You could have sleep apnea. And this is where you're not getting good sleep either. You may be in bed for 8 hours, but you may be only getting 3 hours of sleep. And they found that people with sleep apnea have more heart attacks. With ophthalmology, they have a greater risk of glaucoma because it's decreased oxygen to the brain and all the tissues that are affected by that. And of course, the retina, the optic nerve, they're part of the brain. So your eyes are affected as well, but you don't live as long if you don't sleep well. And so it's more than just going to bed on time and all those kind of things. You have to be getting quality sleep. And the only way you know that is really to get monitored. Now, if you've got an iWatch by Apple, maybe some other fitness monitors will track that as well, but it needs to track the various stages of your sleep and how well you do in all those. And of course, you can have a sleep test done, which is not, like going out to dinner, but it's important to get done. And it could add years to your life.
And those sleep tests today are so much easier than the ones in the past where you had to go into the office and fall asleep in what looked like a hospital room,
Yeah, well, let me tell you, I did it. I did it. So you feel like you're Frankenstein. You go in there. Oh, God, don't hate me, all my sleep doctors. But you go in there and they glue little wires to your scalp. And you got to breathe through this thing, and they're monitoring you. And they're like, okay, go to sleep now.
You're like, what?
Everything's beeping, and you got wires hooked up. You can't turn around in bed, all these kind of things. And boy, you don't get a good night that sleep. You get a good sleep that night. So anyways, it is important to do. And now half the time they can do it at home.
Yeah, which makes it a whole lot easier, because when you're in that room, you feel like, oh, man, I got to get up and go to the bathroom now. You feel like you're inconveniencing.
You got to push the button. Somebody's got to come in and unhook all the wires from you. Then you can go to the bathroom.
Yeah, it's so awkward. So, the one that they do at home is so much easier, and I'm sure they get good data from that.
And let me tell you, it's usually not you who tells you need to get it done.
You're right.
It's usually the person that's with you. Or maybe your doctor may say to someone who shares the same room, or maybe they sleep in a different room now. But anyways, if you think you've got any chance of that, boy, that's important to get checked out.
And the words you usually hear at the doctor's office are, he snores too much and I can't sleep.
That's right. That's right. Or that he doesn't sleep, and then we both have to sleep during the day.
Yeah, take naps.
Well, if you're in bed getting sleeping though you're snoring, you shouldn't be sleepy during the day, and it's because you're not getting the quality of your sleep to be rested at night.
So true. I've known so many people. I can think of at least 5 right off the bat who retired at 50, who retired at 70, whatever age it was. they started to look younger after they retired because they were getting more sleep and less stress.
Boy, you're right. And those are two things that are so important. But, you can't say to someone as a doctor, are you under stress now?
Yeah.
Well, everybody's under stress all
These days, yeah.
Yeah, it seems like all day long to a low level. Unless something really good's really nice, you're at the spa getting a treatment
Just
or
won
something.
the lottery,
Yeah. Oh, by the way, look at the lottery. It's at record heights this week.
Almost $1 billion.
Yeah, $1 billion.
Is it there yet? It was like nine something.
Yeah, but I think
Crazy.
it's at $1 billion now. But once it hits $1 billion, then it'll hit people like me.
Yeah.
Because I'm only going to play it if it's $1 billion. Oh, it's a waste of money. But I do it for entertainment value.
When it gets to $1 billion, that means you can take home about $500 million. I mean, after taxes and all those fees, that's a lot of money.
Yeah. I think it's around 350 now is the one payment deal.
Whew.
But even that would be all right.
So the one yeah. Do you want the lump sum of, I guess, take home $350 million after taxes and all that, or would you like to be paid over the next 30 plus? And I wonder if you're paid over time with the lottery, if you pass away, does it continue to pay, or do they have it set up to where, nope, it's off?
No. It'll get to go to whoever you designate.
Okay.
But you have to have a legal document that designates that.
Gotcha.
Of course, you don't want that to go through probate.
Yeah.
So
It's a lot of dough.
anyways,
Get a lot of
get
sleep.
your sleep. Maybe you'll win the lottery. Maybe that's what we're talking about. I don't know.
Another question we had was, when Botox is used cosmetically around the forehead and the eyes, how is that different from Botox used for medical purposes? Is there a difference?
Yes, one insurance pays for and the other one they don't. So cosmetic anything is not paid for by insurance, but if you have blepharospasm, your eyes just keep blinking. Sometimes they close together. They're hard to open up. Insurance pays for that around the eyes. If you have hemifacial spasm, which may be due to some damage to the facial nerve, the seventh cranial nerve on one side of your face or the other, one side of your face, like if you drew a line right down between the eyes, down your nose, down between your lips, down to your chin, that side of the face will contract. And the other one will not. That's a hemifacial spasm. So that's where you have involuntary coordination or involuntary muscle contraction on that side of your face. And the Botox is exactly the same thing. It gets into the acetylcholine receptors and it helps to stimulate blocking molecules that are released from the neurons that get activated, and it blocks that synapse, that electrical connection of activity to the muscle, and then that muscle doesn't contract. So Botox only works on muscles of expression or that are actively contracting. It doesn't work on resting muscles that are not actively contracting. So the wrinkles that you may have in your face that you have with your normal resting face, it doesn't affect those at all, not one bit. But if you smile or you frown, you get those smile or frown lines, those kind of things that will actively do a great job in minimizing those. And then the dosage determines on how much of a suppression of activation you get or contraction. And it's the contraction that causes the wrinkles cosmetically, and it's the contraction that causes the problems with opening your eyes and your mouth twitching, your eyes twitching for the hemifacial spasm. There's people who have torticollis where it affects their necks, all kinds of things. The only gray area there is probably doing the forehead for migraine headaches. Some insurance will pay for it and some will not. But it can really have a large effect in greatly reducing migraine headaches. So if you suffer from that, you've tried other things, you still suffer from that, boy, you sure should try the Botox, and we'd be happy to help you with that too.
Another question here is, it says, my girlfriend is wanting to do lip injections of Botox. Is this dangerous? And also, do you do that in your office? And I'll just ask this other question too, because it goes right along with that. But it's asking, if you get Botox in your lips too early of an age, is it true that it causes sagging or other problems down the road? So, two different questions.
Yeah. So, great question. So, the one around the upper lip at the lid margins is called a lid flip maneuver. You may have heard of that. And you're inhibiting, you got to be really good at it. And it's just a little tiny bit. And it's just to the superficial muscle. If you go any deeper from that, it doesn't work at all, and it's a waste of money. So it has variable results. There are people that promote it, and it only lasts 2 to 3 months.
Oh, wow.
So I actually have stopped doing that. I just didn't think it was a good deal for my patients. But we do the lid fillers. If you have, like thin lips and you want them plumped up a little bit, which gets rid of the wrinkles or the creases in your lips, makes them look so much better. And I can do just a little touch of filler if you get those smoker lines along those lines. And that's, in my opinion, the best way. And the fillers that we use will last 2.5 years. So, to me, it's a lot bigger bang and longer bang for your buck. Okay. So that, to me, that's a better way to spend your money on that.
So that question about if you get them too early in life.
Oh, thank you. Thank you.
Cause sagging.
Well, you know what? Most of the supermodels out there that are young in their 19, early 20s and those, they're getting Botox.
Huh.
Because it's been shown now through tracking these patients with Botox for really a couple decades now, that if you get it at a younger age, you have less wrinkles, say when you're 40, than if you didn't.
But do you have to keep getting it? I mean...
Yeah, you have to keep getting it.
Keep getting it.
Yeah, it only lasts about 3 months.
Man.
The more active the muscle is, like some people like that will get it around their lips and stuff, which, of course, for some of us, we're using all the time. And as opposed to the forehead or something where you're not doing it as much, it is metabolized and goes away sooner at those active areas of muscle contraction.
I'm glad I went this route in life instead of becoming a supermodel like I thought I was going to do,
Really?
Yeah.
So tell me, at what age did you make that determination?
18, of course.
18. 18. Let's see. I could be a supermodel, or I could go into the family business.
That's right.
I think you made the right decision, too. I think you're probably doing a lot better financially this way.
It sounds like being a supermodel would be painful at times, and I'd be hungry a lot, probably. So I'm glad I didn't do that. Here's another question. What are some of the biggest misconceptions that some patients have about Botox, cosmetic skin treatments, or procedures performed around the eyes?
Well, of course, we do it all over the body, but, and I would say that you're trying to make a change that has been an effect to that face as a normal part of aging or maybe sun damage for a long time. It's a process. Don't expect to have an overnight miracle, but expect that when you go through the process, that you are going to look a lot better, maybe more symmetrical, maybe feel better, have a more rested look, and have a more youthful appearance over time. And, but if you're relying on Botox and these kind of things, you got to know it doesn't last as long. The fillers last a long time and the treatments last a long time. But you still have to get maintenance every once in a while because you continue the aging process.
Yeah. So I guess just take care of yourself, number one. Get a lot of sleep. and maybe use some skin treatments. And,
Absolutely. I mean, why not do anything? That's like saying, I'm not going to ever work out again, take care of my muscles or anything like that. Well, that doesn't make any sense as you get older.
You're right.
So there's all these kind of things. I'm not going to see the doctor anymore. Don't get me started on that one. I'm not going to do any of these common sense things that you're supposed to do as we age. But now making yourself look younger cosmetically, that's a choice.
Yeah.
You don't have to do that because it's not affecting you physically, biologically, but mentally, I would say it would.
Yeah.
So for your mental health, I mean, the people that have had it done that are so happy with it, their families will tell you there's a difference in their aspect and their outlook and in their activity level.
And as far as exercising, just walking every day and doing stuff like pull-ups. I mean, like pull-ups as an example, that's like a whole body workout right there.
Well, pull-ups isn't a whole body workout, but if you talk about doing
like
burpees, that's a whole body workout. That's what the Navy SEALs do.
I guess it feels like it because you're using your almost entire upper body when doing pull-ups. I mean, your stomach muscles, you can feel it tightening up.
Yeah.
I mean,
Seems
like it's a pretty good
Put
deal.
your abs and your legs and your core and
they're not
those
big
are
worked out.
important too.
You'll be like one of those guys who's like super buff at the top and then legs are like small and skinny.
It's like a bobblehead, but it's a bobble chest.
Yeah. Here's another one. What causes macular degeneration? Not pull-ups. They don't do that. And is there anything people can do to lower their risk as they age for macular degeneration? Is that one that runs in the family?
Wow, that's a really tough question. So, a lot of diseases will have some genetic influence, and some will have, 100% genetic determination. But for like cancer, we're all carrying around these genes called oncogenes, which will turn your cells into cancerous cells. And then they have promoters and inhibitors of promoters. And if you smoke, the carcinogens in tobacco smoke stimulate the promoters for the lung cancer oncogenes and other ones as well, cervical cancer, other kind of things. So they have different things, so there is definitely a genetic influence, but it's not the only thing. And because you may have those cancer genes, but if you don't smoke at all, the studies show that you have a much less risk. And you can't live with a smoker either and be breathing the same air like that. That secondary smoke is pretty much just as bad. So, yes, there is a genetic influence. And yes, you should be attuned to that. And yes, if it's in your family, then you should be more vigilant about detecting that. And if you do develop it, you should be more aggressive about treating that.
I remember the days where you would go into like McDonald's, the whole place would be like a smoke cloud because everybody in there was smoking as they ate breakfast or lunch.
No, you know where it is? The Waffle House.
Yes, everybody smoked in there too.
The Waffle House was bad. And going into any gas station.
Yeah.
Right, to pay your bill. Remember when you couldn't pay at the pump, you'd have to go in to pay? Remember those days?
Yep. And
that's how old we are, folks.
Credit card machine, that thing they...
click, click.
Yep.
So, yes. So, you can be around noxious vapors like that. And you could be around asbestos fibers and chemicals at work. And there's all kinds of things there. But as far as the question was, how do we avoid macular degeneration? Right. So let's get back to that. The best way is like avoiding bad things for other things in your body. And that is keep your blood pressure, your serum glucose, and your cholesterol under control, good control. And when it's cholesterol, it's not your total cholesterol. It's your ApoB, it's your LDL, it's your HDL. It's those are the most important ones. Get a calcium scan to look at your probability of getting a heart attack in the future. A lot of our medical tests now are to determine disease in its presence. it's not to be good predictors of developing disease in the future. And for those, you have to do some different blood work. And I would suggest that people that are interested in trying to prevent disease and increase their longevity maybe look at some things by some doctors and credible sources on the internet or YouTube or something like that. And, when you go see your doctor, ask them about getting these things measured as well. Heck, you're getting your blood drawn. As long as your insurance covers it, you might as well.
Yeah.
And if it doesn't cover it, it may be worth, a couple $100 to find out about things that could help extend your life.
Absolutely. Again, Dr. Craig McCabe from McCabe Vision Center in studio with us this morning, and we're wrapping up right now. It's 8:59. One more question that was asked, going back to floaters. Are floaters things like dust and debris in your eye?
They're actually aggregates of protein called collagen. And when bright light comes through your eye, it hits that collagen and that casts a shadow on your eye. So you're actually seeing the shadow of the floater rather than the floater itself. But let me say, I thank everyone for calling in. These are great questions. Please save them for the same second Monday of the month next time, or give us a call at McCabe Vision Center. We would love to help you.
Sounds great. Again, Dr. Craig McCabe at McCabe Vision Center, online at McCabeVisionCenter.com.
The Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
Adam's Place. There's a pool, there's puzzle rooms, and all sorts of things to keep you busy, no matter what you want to do.
This is Terry Deal at Adam's Place. Call me at 615-904-9111. Adam's Place on Memorial across from Walmart.